Hello, hello. Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And I am Dr. Anna Shaw Devlin. And tonight is our SHEM 2 night. That is a spiritual, healthy, enlightening mandate ministry. And I am so enthused that viewers have been watching our last 2 weeks presentations on fentanyl. We talked about facts, not fiction. And I actually thought I was kind of finished with that topic. And last night, my husband, one of the lead servants of SHEM Ministries, and I love calling him Pastor, announced that I was going to be talking about fentanyl again. And I said, I was? Did I say that last week? And he said that there was some more meat on the bone. Now, those of you who have eaten a good, well-seasoned piece of meat that was well done and, flavorful and not burnt and whatever, you know what it's like. Okay, something was wrong. You know what it's like when you gnaw the bone, when you feel a desire to gnaw the bone. Well, whenever he says that, I'm so appreciative of that. And, I went back and I listened to my videos and I said, Lord, yes, I need to say a little bit more about, yes, I need to say a little bit more. So I've got, I guess we're going to regurgitate some stuff and eat it again, but this time it's going to taste better because I'm not going to just throw a whole lot of stuff out there. I'm just going to take some things that we already talked about and dissect it just a little bit better for you. So, first of all, let's give honor to Christ. Without him, we would not be here. So, Father, we give you all the honor, the glory, the thanks, and the praise. Thank you for this day. Thank you because this is a day that I have never seen before. Thank you for giving me an opportunity, Lord, to continue to be the servant that you called me to be. Thank you for allowing me to just speak a word into someone's life. Not for a show, but for your glory, Lord. Thank you for how you have allowed people to bless me in the midst of my giving. So, Father, I'm asking right now, as I empty myself out, you fill me and use me as that empty vessel. Allow me to glorify you in all that I do. Allow me to just bless those who seek, hunger, and thirst for what is right. Yes, the word of God, but also the truth. Once you are dead and gone, knowing the truth does not help. It doesn't help you then. So we must get the truth out now. So, some more facts. Tonight, I do want to focus more on saving the life. After the drug has been used, after you unknowingly ingested something that was laced with fentanyl. But, because my husband asked me a question about CPR, And, we always said, be trained in CPR. If you're not trained, get trained. I believe when someone is dying, I'd rather do it wrong than not do it at all. Now, those people, I don't know CPR, I'm scared, I can't do. No, let me tell you something. A little is better than none, okay? And even now, the new CPR, I'm getting ready to recertify again, but new guidelines, guess what? People were scared. I ain't doing no mouth-to-mouth resuscitation on nobody. I don't know where they mouth been. Okay, I get that. But guess what the new guidelines say? Forget about the oral airway and trying to blow air. Guess what? Fast and hard. Fast and hard. That is the new thing. If you don't have an airway, they're not telling you to do mouth to mouth. If you don't have a barrier to use, and this is even for trained providers, fast and hard. You pump on the chest, over the heart primarily, the palm of your hand, the sternum, over the chest. Use the breast, the nipple, as a guideline as far as how high up or how low your palm of your hand needs to be. And you clasp them together. It doesn't matter if you just pump fast and hard. 80 to 100 is what you need. Don't try to count up 15 to 1 or 15 to 2 breaths every 5. No. Okay? Fast and hard. And get someone to call 911. Like I said, no one gets high by themselves. I shouldn't say no one, but it's not likely that a person would try to get high alone. Fast and hard, okay? So let's, since we're talking about the fast and hard and the CPR, let's start with the Narcan again, because that was one thing that I wanted to go through and hash out some more, provide more clarity on what is Narcan and how to use it, okay? And I did show you some pictures, okay? You've seen my face enough. Let's see. Let's scroll up. I showed you that this is what the vial of Narcan looks like, which is injectable. But guess what? If you're not trained professional in a hospital setting, who has time other than EMS, where there's 2 or 3 paramedics in the truck, for someone to be drawing up an injectable Narcan if you don't know how to draw it up, okay? Now, I think there are some pre-filled syringes, okay? But for the most part, this is what Narcan looks like, all right? Then we talked about the nasal spray. Now, this is the thing that really, I feel is beneficial. Now, the injection, now, of course, you can't get everyone to sniff the Narcan. However, the injection into the muscle, if you have a pre-filled syringe. But, I do want to say this. Let me say this. Most people who do drugs, they know how to draw up a syringe. What am I thinking? Okay? Yeah, they do. So anyway, regardless. And I do want to say this. Last week's segment, I had someone comment about that Narcan and syringes should be part of the first aid kits that we buy now. That is something to think about. First aid kits. Is it going to come to that? There's so many things that we have today that I never thought we would have. Like a watch that, the Apple Watch that you can answer and talk. I mean, I even think about how on my smartphone, I can be hours away and answer my door and talk to the people. I remember one time there was this delivery that came to my house that I had to sign for. And I didn't, it was something that came all the way from Minnesota, and I did not want them to send it back. And what is wrong with this thing? Hold on, let's see. My CPU load, I've got to get my Wi-Fi straight. Hold on, so that we won't have any problems, and it's not letting me. So let me see. Uh-oh. Anyway, hopefully we're not going to have any issues. Maybe it's the phone and not. All right, it's always something, right? Okay, but anyway, what I'm trying to say is technology has advanced so much that it's so surprising. Why can what's necessary to save a life not be readily available? Look at the AEDs, automatic external defibrillators, that are everywhere. You go in Walmart, wherever you go, you see these AEDs. Remember when we thought it was weird? Like, what in the world? I know as a provider, I was like, how are you going to get trained people to know how to shock somebody's heart with electricity? But guess what? Technology was so good that the AED told you what to do. The AED says, shock advised. Tells you everything to do. Tells you where to put the pads at on the person. It says analyzing, don't touch. Analyzing, don't touch. I mean, it's just amazing. So, yeah, that's not a bad idea. We have got to figure out how to save lives. How many times do we make mistakes? How many times we talked about the seatbelts? You didn't even realize you were driving that fast in the rain. Not that you were speeding, but you were driving too fast for the conditions of the road. And if it had not been for that seatbelt, so if it had not been for the Narcan in the first aid kit, thank you, Lord. All right. The first thing I want to clear up is I need people to know what Narcan is. All right. And I've got a slide here. Let me see if I can figure out which one it is I made. I think this is it. Yep, got it. It says Narcan Facts. Narcan is the same drug as naloxone. So now everything is generic. And there are people who only know generic names of stuff. They don't know the trade name. Narcan is actually the trade name. Naloxone is the generic name. So it's not a different drug. It's the same thing. Okay? So that's one thing I wanted to clear up, because I say Narcan all the time. Okay? We mentioned the fact that it's readily available. Okay? Injectable and nasal spray, which I just showed you. Depends on your state. And some insurance companies will pay for it. So it's actually, there's it's a prescribing guideline. There are guidelines now that say, if you prescribe an opioid for someone, the guideline says you prescribe them Narcan as well. It's like you can't have insulin without a syringe. They come together. So the new guidelines are, as a provider, you give someone an opioid, you should give them Narcan. Now, let me tell you one pain pill that Narcan doesn't work for, because tramadol or Ultram is not really a opioid like oxycodone is. Yes, it's a pain medication. It does treat pain, but let me tell you exactly what it's classified as. It does not, you cannot give Narcan to reverse tramadol or Ultram. Nope, doesn't work that way. So it is a central opioid agonist. The exact mechanism of action is unknown. It does bind to mu opioid receptors and weakly inhibits norepinephrine serotonin reuptake, producing analgesia. The way it works is totally different, but it still works. It's kind of like two people have the same destination. One goes this route, one goes this route, but oh my gosh, they both got there at the same time. But the route that the oxycodone takes, Narcan will knock you down. The route that the tramadol takes, Narcan's not going to knock you down. You actually have to give something else with it to not have detrimental side effects. You can give it, but you may create more of a problem. So just trust me, okay? It's too much to try to explain to a lay person, okay? It's even a little whatever, for some of us that's supposed to know, okay? Because things are constantly changing. So it reverses opioid overdoses. This is the thing that I was telling you on last week that I realized I need to give you more specific information. I was telling you that you may have to give more than one dose of Narcan. Let me explain why. It's an opioid overdose. It reverses it, but it only lasts 30 to 90 minutes. So, fentanyl, remember what I said. So, morphine is an opioid. And if fentanyl is 100 times as potent as morphine, the amount that would normally work for the morphine, you're going to need a whole lot more than that. And to even reverse it. But then, remember when I told you the half-life and depending on how it was, administered, you're going to need more. Anyway, it's just not a simple one-dose thing, okay? But I wanted you to know that even with the opioid itself, the Percocet and Lortabs and all of that, 30 to 90 minutes. So it depends on how much they had. They may start to breathe in better, but then all of a sudden the drug kicks in, or they kept using. Remember when we talked about that? And then by the time that kicks in, here we go again. It's kind of like the diabetic who blood sugar dropped, and you gave them something and their blood sugar came up, but then it didn't stay up. It started dropping again. That's because the action of the duration of the insulin that they took was prolonged. Same thing. So you have to get them to keep eating, keep drinking, to keep the blood sugar up. Same thing, okay? So, and then we also talked about it's available prescription and over the counter in some states. Now, this stuff here, I'm telling you, I could research and anyway, there is so much. I'm going to have to, if the Lord says next week, do more, I have no choice. But there's so much info, y'all. So much that you can just go on and talk about this for days and days. You really can. I mean, well, not days and days, but for hours and hours. And so, anyway, I just wanted to go over that about the Narcan. Now, remember last week when I said something about different pills, the real deal, and what they look like, and people know that they have markings and all of that? So I took the time, and let me get rid of that. And I found some pictures of fentanyl, and these are the buccal tablets. Now, I do want to explain to you the difference between formulations. Let's see. I want to make sure. Do I need to go back? And no, I think I'm good on that, on the Narcan. Yeah. I just want to make sure before I put this away that everything that I had, anyway, I think we're good on that. Let me put this aside. All right. But in regards to the different formulations and stuff, I need you to know that when something is buccal, and that's buccal, buccal or sublingual are not swallowed. So the tablets that I'm getting ready to show you, they're kind of like disintegrating tabs. There are what's called Troche, Troche, which is like a lozenge. Remember, we used to have those lozenges you put in your, like chloroseptic lozenges, right? So there are fentanyl buccal tablets made like that. When they get moist in the mouth, they start to break down, kind of like, Alka-Seltzer, plop, plop, fizz, fizz, but it's fizzing, disintegrating in your mouth. So people who use the buccal, they put the medication between the cheek and the gum, deliberately, between the cheek and the gum, and let it dissolve. Sublingual is up under the tongue, like people who had heart disease, and they would take nitroglycerin. Most people knew that little brown bottle with the, there were nitroglycerin tablets. Now, nitroglycerin, I always used to tell patients who took nitroglycerin for chest pain, if it didn't burn when you put it up on your tongue, it's old, ain't no good. Okay, because the treatment is take 3 two sublingual nitroglycerins, 5 minutes apart. And if you're still having chest pain after taking the second one, right, within 5 minutes, you need to be calling 911 while you're taking the third one. But I've had many people still having chest pain because they were taking old sublingual nitroglycerin. So the reason I mention that is because most people are familiar with a sublingual tablet. Okay, it dissolves up under the tongue. All right, so that's the buccal and sublingual. They are not swallowed whole. Okay, there are other tablets that can be swallowed whole. Now, I did a little bit more on fentanyl dosages. I did a little bit more research on what's available today, because I want you to know that the buccal tabs, they come 100. Oh, I was going to show you the picture. I'm sorry. This is the good time for me to show you the picture, because what I found out, this is what they look like. Now, the fentanyl buccal tablets have this C. I don't know why they have a C, but they have a C. And if you look at the flip side, it has a 1 on it. Now, I only took a picture of one of them, but guess what I'm getting ready to tell you? That 1 corresponds with 100 micrograms. Now, if it has a C and a 2, that is 200 micrograms. 4 is 400, 6 and 8. Now, the reason why this is so important, because if someone were to give you a pill, you need to know how much it is. And, oh yeah, man, just take this fentanyl right here, blah, 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 whatever, it ain't gonna hurt you. You look at that thing and say 100 micrograms. Whoa. Now, guess what? Fentanyl at very low doses is potent. So 10 micrograms. Okay, I'm trying to tell you that 100 microgram right there put a horse down and keep them down. All right? It will. No joke. So and here is an example of some information about the actual tablet, this, that, and the other, so you know it's the real deal. Okay? I wanted to show you an example. It has a big old C on it. Now, I want to talk about FDA approval. Of fentanyl and how it's changed. Now, most people know that FDA approval doesn't last forever. A drug may be approved for 5 years, 10 years, whatever, but then it has to be approved again. And it just depends on what it is and where it is in the research trials and experimental phases and this, that, and the other. They go back and they approve them. Remember what I told you about fentanyl? It began in 1968. And it was called Sublimase, and it was injectable only. And it wasn't until, I did my research down here, to 1990, when the fentanyl transdermal patch came out, and we called it Duragesic. And that was actually August the 7th of 1990. So look at how many years. That's why it didn't get well known. because for all those years, it was an anesthetic drug. Until people started using it for severe pain. And the sad thing about it is this, y'all. It's for cancer pain. It was for the babies, children, little kids, and adults. Children die with cancer too. They get bone cancer, different sarcomas, and they die too. And they don't deserve to suffer in pain. So this drug that was developed in 1968, and it's a good drug. It's just got a bad name right now. It's probably like, I'll never forget propofol after Michael Jackson died. Propofol is this white milky substance that's given IV that, woo, it is good in the operating room. But then when Michael Jackson died, oh, everybody was like, you ain't gonna give me no propofol, are you? And oh God, I spent so much time trying to convince people that it wasn't the propofol. It was who gave it, where they gave it, and how they gave it. So don't get me wrong about fentanyl. Fentanyl is awesome. If you've ever been in a situation, you want to have a drug that can get rid of your pain. You do. You really do. And I'm going to show you. Oh gosh, where's my slide? I am going to show you. Is this it? I'm sorry. I hope it is. Hold on. Yeah. That's it. Here's some more fentanyl facts that I put on a slide for you. Yeah, it says synthetic, man-made, 1968 for severe pain. We talked about the potency, 50 times heroin, 100 times morphine. Talked about the fact that it's available in many forms and dosages. And I just went through how 800 micrograms for buccal sublingual tabs, but the patches, they don't come that high because the patches have a small incremental delivery over 3 days. Okay. But this is the statement down here that I really want you to understand. Fentanyl is a pure opioid. It's synthetic. It's a pure opioid. It's larger. It has a larger effect at higher dosages. Okay. And it has no ceiling effect. So there are drugs where you saturate, you get a level of saturation. Like, I don't care how much more you take, you're not going to get no more benefit from it. You ever hear your doctor say, I can increase the dose, but you really it's not going to help you, because this is the level that the drug gets in your body where it has the most benefit. I was trying to remember the actual. There's another term. It's where it does the most benefit at that certain dose, and it's not going to help you if you go higher. Okay. And actually, there are some medications, the way they are in our body and the way the body metabolizes it, that actually you have a better outcome with a lower dose. But fentanyl is one that if you still hurting, they can keep giving you fentanyl and keep giving you fentanyl. That's why it is an awesome anesthetic, and it works good for people who have developed a pain tolerance. Remember what I said? When you hurt and your body builds up a tolerance to that dose, then it's good to know that there is a drug that can be more beneficial. There's no ceiling. You don't reach the ceiling. There's no plateau, right? So fentanyl can't go away. It's just going to be, I believe, extremely difficult to acquire it legally. But we can't let our cancer patients suffer and die. We can't. I don't know if you've ever seen someone truly suffer and die with cancer. Moaning and groaning every breath they take. And, you know, I had to prescribe some morphine sublingual that we give. We squirt it in the mouth, under the tongue, or in the buccal cavity, so that the patient, you know, you would kind of like with the baby, how you would hold the jaw where it won't drip out their mouth, so it would absorb, and they would get the medicine, or you would squirt it in the back of their mouth. But when people are almost unresponsive because they're hurting that bad that all they can do is take a breath, you want to be able to set them free from that pain. You want to. So I pray that we can get a hold of this. I just believe it's just going to be a lot of regulations, and it's going to be a lot of different things, you know, but I don't know what they're, you know, the DEA and other organizations and groups are trying to come up with. But I know that we cannot get rid of fentanyl. Okay, cannot. It's been around too long, and it's an awesome drug. And I know that if my time comes to that, I don't want to suffer. I want to be able to have something that's going to take my pain away. Okay, I do. So I was going to give you the years, just how the drug itself evolved. So the Duragesic, like I said, came out in 1990. Let me see, the lozenges that I told you about, the Troche lozenges, actually came out in October 4th of 93 was when the transmucosal, okay? And then the Troche lozenges were in November 4th of 98. So guess what this corresponds to? Remember HIV? Remember how painful it was for those dying with HIV? How cachectic they looked and emaciated, and they were in a lot of pain. It was like almost like sickling pain. So if you notice, a lot of the changes to fentanyl happened in the 90s, around that time. All right, in the 90s. And then the drug itself, you know, the metered nasal spray, Lozanda, was in June 30th of 2011. Anyway, I'm going to get off of this, but I just wanted you to know that the drug evolved, but it evolved necessarily. So the misuse of the drug we have to do something about the misuse, and or at least tailor deaths, plummet the number of deaths. And as I said to you on last week, we all are going to have to get involved in order to do that. Not just healthcare providers. That's what I'm telling you. Learn CPR and learn how to use Narcan. Don't be afraid. Be responsible. A responsible bystander, if you want to say it like that. Like I said, you know who uses, or you suspect. And like I told you, I haven't gone yet to get mine, but I've got to. All right, so we talked about that. I told you I was going to discuss that. What else was I going to tell you? Oh, one main thing that's on here at the bottom. How could I almost forget it? This is very, very important. The doses of fentanyl are not equivalent between formulations. For example, look at this example up here. 25 micrograms of a fentanyl patch does not equal 25 micrograms of the fentanyl for injection. So you can't say, oh yeah, I've had 25 before, I'll take that. No. Injection, especially if you're injecting it into the bloodstream, the rapid absorption, but they're not equal. They were not created equal. Let's see what's wrong with this thing up here. I tell you, it's always something. CPU load. And the thing about it is I don't know how to fix it. All right. Just keep rolling, keep going on. It's like I said. All right. But that was the main thing I needed you to get, was the fact that the dosages are not the same. Now, one thing I want you to know. Oh yeah, here it is. Extremely high risk of overdose. Always safe to underestimate fentanyl requirements. Yeah. About them not being equivocal. Do not try to convert it on a weight for weight basis, because it's not the same. The dosages are not the same. I do want to talk about side effects and contraindications. And this is for even prescription use, right? So we've been talking about illicit drugs, but I really need to go back right now for being a responsible chronic pain. Don't let someone just put you on fentanyl. So if you keep saying, doc, oh my God, my pain is just not getting whatever. And the doctor has umpteen patients and says, well, look, let me just put you on this low dose of fentanyl. Okay, I need you to understand. Do not use fentanyl unless you are already using an around-the-clock opioid medicine and are tolerant to it. Let me say it again. If you say, doc, I can't get my pain under control, and he suggested or she suggested you using fentanyl, you have the right to say no. And the reason you're going to say, I'm going to tell the doctor, yeah, you're going to tell the doctor no, and I'm telling you why. Sometimes we holler, I'm hurting, I'm not getting any better. But have you maxed out on the medication that you're using? You have to take it around the clock. And I'm not saying just for one day. You have to be able to take it around the clock and not be asleep the whole time. Still able to function. That is when you can say you are tolerant to it. So if you're taking Percocet, the maximum dose is 10,325, right? So that's oxycodone, 10,325. And you're taking that every 4 hours, because that's the lowest frequency of its use, every 4 hours. So you're taking the highest dose of Percocet every 4 hours around the clock. So that's 6 to 10, 6 o'clock in the morning, 2 o'clock in the afternoon, 10 o'clock at night. No, 6. No, that's every 6 hours. 6, 12, 18. Anyway, wait, I'm sorry. But anyway, if you're taking it around the clock, I think I had it right, 6 to 10. No, that's every 8 hours. Okay. Anyway, it's 2-8. That's every 2-8 is 6 hours. So 6, 10, 2. 6, 10, 2. 6, 10, 2. That's what it would be. Sorry. Got it. It's been a while. But if you're taking it like that, 6 o'clock in the morning, 10 o'clock in the morning, 2 o'clock in the afternoon, 6 o'clock in the afternoon, 10 o'clock at night, 2 o'clock in the morning, consistently, and your pain is still, that would be the only time you're tolerant to that medication. You're not over sedated or so sleepy that you can't, wake up and function. You can't do for yourself. You're hurting that bad. That would be the time that if your doctor presented the idea, but still remember what I said, how potent it is. You gotta be honest and know yourself. Yes, you can tell your doctor no, but tell him why. Doc, I don't think so. Not for me. Because guess what? You the one gonna be dead. He's got it documented in his chart. Uncontrolled pain, states, worst pain I've ever felt. I can't, states, I can't live like this much longer. States, nothing else works for me. See, you be blabbing and running your mouth and you be saying all this stuff that if you have not maxed out and know you are tolerant to that drug, don't be so open to say, yeah, give me that other stuff. Ain't there some better stuff you can give me? You're killing your own self because you don't understand. But guess what? After tonight, you will understand. The blood is not on my hands. I'm telling you. You have to be tolerant to around-the-clock medicine. Okay. Now, here are some contraindications. Severe asthma or other breathing problems. Because the medication itself, if you've got severe asthma and it suppresses your respirations, right? And secretions build up, oh my gosh. Okay, you can aspirate, one thing, okay? Stomach or bowel obstruction is a contraindication. Paralytic ileus. What is that? That is when your bowel is paralyzed. My bowel can get paralyzed. Yes, your bowel can get paralyzed from, guess what? Narcotics, opioids. Opioids slow down digestion. They slow down peristalsis, which is that movement in the colon. And when things slow down, you get constipated. And when they slow down so much that the bowel gets paralyzed, there's no movement anymore. That is a paralytic ileus. And when that happens, people start vomiting, they start having abdominal pain and all of that. And guess what happens after that? You get a bowel obstruction and you can need emergent surgery and have to get part of that bowel that has died removed and end up with a colostomy bag and all of that. You feel me? All right. So that's contraindicated if you've had a history of that. Now, if you've ever had sleep apnea, now why would they not want to give fentanyl to someone who has sleep apnea? Because if you have sleep apnea, that means that you stop breathing in your sleep. So if you got somebody already stopped breathing in their sleep without fentanyl, oh my gosh, they gonna die in their sleep. Ooh. Yep. If you've had a head injury or seizures, and that's with any mood, mind altering, altered mental status, level of consciousness drug, you have to give that with caution. Low blood pressure, because opioids lower your blood pressure anyway. Slow heartbeats or other heart rhythm disorders. Yep. Drug or alcohol addiction, depression, schizophrenia, or hallucinations with caution. You know why? Because there's a drug-drug interaction. The drug interacts with the other drugs that you may be taking. Remember we talked on last week about the benzodiazepines and not mixing them together? If you take SSRIs and SNRIs like Zoloft and Effexor and those drugs, and you mix them with fentanyl and whatever, you can have a synergistic effect and you can have what's called serotonin syndrome. I'm telling you, that is the reason why the law, government, whatever says, when you get a new prescription, guess what the pharmacist has to do? They have to physically talk to you every time you get a new drug. They do. They have to. When you get a new prescription, not a refill now, but every new prescription, it's not enough that they give you the literature. Because guess what? You know how many people are illiterate? Huh? Do you know how many people are they're essentially illiterate. They can read enough to read their name, or they can read enough to, kind of fool people and get by with, but they really can't read well. When you have a second and third grade education level or reading level. But now, don't try to cheat them out their money now, because they will put something on you. They is street smart, and they smart now, but they're illiterate. So giving people all this literature with their medications, side effects and all of that, So the pharmacist will pull you to the side and talk to you and tell you, you cannot drink alcohol with this medication. You can't this, that, and the other. Okay? Do you know how many babies have been made because the woman was taking birth control and had a urinary tract infection and was put on an antibiotic, and no one told her that this antibiotic will decrease the effectiveness of your birth control pill? And you be like, I've never missed a pill. How did I get pregnant? And you know what I asked people? I said, well, have you taken any antibiotics recently? Yeah, how'd you know? There it is. Okay. So, let me get rid of that let's get rid of that. Okay. All right. So That was some. We already talked last week about liver and kidney disease, the liver detoxifying and the kidneys excreting, urination problems, problems with your thyroid, gallbladder, or pancreas. And these are only because of elimination of the drug in your body. All right. Of course, tell your doctor if there are children living in the home where you will store your fentanyl. The amount of fentanyl in this medicine can be fatal to a child. Guess what? It can also be fatal to your dog or your pets, your kitty cat. Can you imagine a cat licking a sublingual, buccal, disintegrating fentanyl tablet? Huh? That's sad to think about. So being responsible, and I'm telling you all this stuff because at some point in time we don't know what we're gonna have to go through, and knowing this may be beneficial, not just for the addict or the person who uses. This is just stuff that just being a responsible person that never knows what kind of pain they may have and may need that medication. Okay, because I'm not telling you not to lay there and suffer, but I'm telling you, before you allow someone to give you fentanyl, make sure you maxed out on the other medications and that you're taking it around the clock. Because the doctor will say, are you taking it? Yes. Are you taking it as prescribed? Yes. But are you taking it around the clock? No. And also understand that if you use opioid medicine while you're pregnant, your baby could become dependent on the drug. And these are babies born dependent, drug addicted. Okay? Not that it's illicit, prescription. Yep. Life-threatening withdrawal symptoms in the baby after it's born. Babies born dependent on opioids may need medical treatment for several weeks. Takes a while to kind of get over that. Now, let me see what else. We talked about this last week about how to dispose of the medication and programs. And I know what I wanted to go over with you. This is something, costs. I got this information here and I did not have time to put it on a slide. So I'm going to read it to you. Now, this is drugs.com. Now, of course, I could have pulled up Good Prescription, Good RX, but I didn't. I wanted to pull this one up. Fentanyl prices. Now, listen here. All right, fentanyl is a member of the opioid, narcotic, analgesic drug classes commonly used for anesthesia, anesthetic, adjunct, breakthrough pain, and others. Brand names include Actique and Fentora. The cost for fentanyl injectable solution, just 50 micrograms per milliliter or cc, is around $20 for a supply of 20 milliliters. 20 milliliters. Okay. Anyway, it depends on the amount that you're taking, how long that's going to last. But I found this here for fentanyl prices, and I know you can't see that because it's too much light. Nope, you can't see it. I'm sorry. Nope, can't see it. So I'm just going to read it to you. 100 microgram fentanyl buccal tablet costs anywhere from $1,391.29 for 28 tablets. So hopefully you got some prescription drug coverage. And the price goes up as the dose goes up. So an 800 microgram fentanyl buccal tablet is $4,060 $0.99 for 28 tablets. The reason I'm taking the time and telling you this is because I want you to understand why the black market and the illicit drug manufacturers is so prevalent. Okay? Well, I can get it cheaper on the black market. Be careful what you're getting on the black market. Don't forget about the fentanyl test strips. And that's not for, so I'm intertwining illicit drugs with prescription because I need you to know that it is so easy to go over to the dark side when you're in pain. If your copay is $300, somebody will say, girl, I can get you. And I've heard, listen, let me tell you something. I've heard people talk about going to Mexico and getting their medicine, thyroid medicine, all kind of stuff, insulin. Remember how a while back it was so difficult to get insulin? And in legislature, they were talking about how they were going to cap these pharmaceutical companies and fine them for charging so much money for people who they couldn't get insulin. And there are people who literally had to go to Mexico and get their insulin. They did. They had no choice. It's either die with a diabetic coma. What are we gonna do? But I'm saying be careful. Don't forget your fentanyl test strips. If you end up going to Mexico to get your pain medicine, I mean, you can probably take I don't even know if you could take your prescription to Mexico and get it filled. I mean, I have pre-op patients before that lived here in the United States that told me they went to Mexico. They went home to get their medicine. They didn't say pain pills. But they went to visit their family in Mexico, drove all the way to Mexico to get their stuff, their pain. They would go and get months and months worth of their medicine for not just for them, but for their family. And like one family member would go and bring back medicine for everybody because medicine costs so much in the United States. It was cheaper. It was better to live here in the United States, right? There was more access to this, access to that. But the things that the United States is jacked up for, they would go home to get. Yeah, there are many people that do that. There are people who live here in the United States and get all their whatever from their family in Africa. They ship it to them, and over time it's cost effective. You do what you have to do as a consumer. But I'm just saying we got to do it with caution. And when you are desperate, your guard is down and you may not think clearly enough. So that is the buccal tablets, $4,000. Then, as I told you, the injectable solution, 50 micrograms per milliliter for 20 milliliters is $19.66. But 20 milliliters ain't gonna last you that long. But anyway, it's better than nothing. The $263.55 for 500 milliliters. That's how much you're gonna pay for 500 milliliters. Now let's put milliliters in perspective. If you don't know milliliters, 1,000 milliliters is 1 liter. So if you look at, there's 30 cc's or 30 milliliters in an ounce. Okay? If you look at an 8 ounce bag, bottle, whatever. It's like 237 milliliters, 8 ounces now. I didn't say 16-ounce bottle, 8 ounces. About 120 milliliters in 4 ounces. Think about the 2-liter bottle, right? That's a fat. So we're talking $263.55 for 500 milliliters. That's a fourth of a 2-liter bottle. Okay, all right. I just want to put that in perspective because a lot of people don't understand milliliters and cc's. Okay, there's 5 cc's in a teaspoon. All right. Oral transmucosal lozenges, the Troche. If you were going to get, for example, if you're cancer pain, 400 microgram fentanyl lozenge, $617 for 30 lozenges. Depends on how bad your pain is. The transdermal film, extended release. These are the patches that you wear. The lowest dose, now here, these are the dosages. And like I told you, the maximum dose that the fentanyl patch comes in is 100 micrograms. The lowest dose is 12. And 12 is significant. Yeah. So remember when we were saying about if your doc feels that you need fentanyl patch, how about don't start with more than 12? That's wrong. 12 micrograms, right, is the lowest dose. It's $41.98 for 5 patches. You change these patches every 48 to 72 hours. Primarily, we always would start with every 72 hours. Okay? Let me tell you this. If they start you with 12 mics and it's not helping after the 3rd day, you got 5 patches. Talk to your doctor and get him to allow you to try 2 patches at once, which would be 24 micrograms, before you spend money on getting a new prescription for the next higher dose. Because guess what the next dose is? 25 micrograms. You're only missing a microgram an hour, okay? So, you feel me? The next dose is 37.5. So you would do the same thing. Okay? You got some 12s and you got some 25s. That'll make 37. That's the way to titrate if necessary. And the only reason I'm taking the time and telling you this because I'm trying to help you save money if you ever in that situation and you do need, God forbid, you need fentanyl because you are dealing with a cancer situation. Because the 37.5, guess what it costs? It's $104.44 for 5 films. Yep. All right. So I think that's the extended release. All right. And I told you it goes up to 50, 62.5, 75, and then it goes to 87.5. And 87.5, that's a lot. Well, anyway, no, it's $558.67. Okay. But then at the bottom of this, guess what? Fentanyl offers may take the form of printable. They have coupons and rebates and savings or copay cards. Yep. Trial offers or free No, ain't no free samples. Not when it's generic. But anyway, there are some discount things available. And this is a drug discount program, not an insurance plan. Valid at all major chains, including Walgreens, CVS, Pharmacy, Target, Walmart Pharmacy, and all these other 65,000 pharmacies nationwide. So I'm just letting you know, giving you info. And then there's also this patient assistance program, cost-free or discounted medicines. So yeah, it's not cheap. You don't have to go to the street drug, because remember what I told you about the street drug. It may not be pure. Nope. My understanding is that they are putting roach spray and all kind of stuff in these formulas and formulations and trying to sell them as such. Anything that they think they can, additive that they can put in it to get you high. All right, well, let me see what, I think that was it that my husband mentioned to me. We wanted to talk about, I gave you the poison control. I don't know if I did or not. Oh, and just in case, I don't think I did. Okay. We have to talk about poison control. Poison control. Anyone gets in trouble, dial poison control and let them help you. But as a bystander, start CPR, even if you don't know how. Fast and hard. Fast and hard. And you always, you can't see that. I'm glad you didn't see that. But and you always have to have the person on a flat surface, or CPR is not going to work. You got to have them on a flat surface so that when you push down on the chest, you're compacting and causing the heart to beat. Okay? Yep. And this was the last thing I do remember. He told me, since we're talking about CPR again, I wanted to share with you how long you have until the brain dies. You need to start, when you notice that someone is not breathing, check a pulse, okay? You got to start CPR right away. Like I said, if you start CPR and they wake up, yay! Because I'm going to tell you what hurts. Pressing on someone's sternum. I had a lady one time, I saved her life. I did CPR on her. She talked so much junk to me the rest of the night. I brought her back. But her chest was hurting from me pounding on her chest. She was so mad with me. I said, well, maybe I don't need to be your nurse the rest of the night. I mean, dang, I saved your life. I did CPR and I pumped on your chest. Her chest was hurting. She was unresponsive and heart had stopped. She didn't know. But all she knew was when she woke up, her chest was hurting. I apologized. I said, but honey, she didn't care. When I said, well, your heart wasn't beating. I had no choice. But my chest hurting now. I thumped you, got you out of rhythm, and started singing. Anyway, it didn't matter. But anyway, begin CPR. Within 2 to 3 minutes of a cardiac arrest. Depending on how healthy that person is, permanent brain damage can begin after only 4 minutes. I didn't say permanent to the point where they will never wake up again, but permanent as far as acting like they had a stroke the rest of their life. Permanent as far, you know what I'm saying? I didn't say, When something is permanent, that means they don't recover from that damage. I didn't say permanent, no brain activity. But 4 minutes without oxygen is not good. Can precipitate death. And the brain starts to die. 4 to 6 minutes after that, you might as well say it's probably over. And that's the reason why they'll say, how long has this person been down? You come rolling through the ER door. How long they been down? That's a common question. And they'll say 10 minutes or whatever. And they're like, all right, we'll work on them for another 5 minutes. So within 15 minutes down, we know we clear. That's it. We ain't gonna work no more. It is what it is, okay? All right. So, and last week when I was talking about luminol, that I went back and made a little comment that luminol was what I was talking about, that they used to test for blood. So anyway, I do hope and pray that this information that I have presented to you for the last 3 weeks will be beneficial to you. I think I went back and cleaned up some stuff. I hope and pray. But like I said, please do your research. There's so much out there. There are videos out there that will show you how to do these things. Show you the appropriate way to give Narcan. Show you how to do CPR. Show you, oh my gosh. You can get CPR certified online now. So much. There's no reason. Put forth the effort. Like I said, we are having to do things that we never thought we would have to do. Yep, we are. But is it worth it? It is. Because guess what? You reap what you sow. I believe if I save someone, God gonna save one of mine. I do. I do. I believe that I'm sowing seeds not for myself to reap, but for my grands and great grands and that I've never seen and may not never see. But if this wicked world lasts that long, if God doesn't come back and yep. All right. To God be the glory. God bless you until we see you again on Sunday. This is Dr. Anna Shaw Devlin, family nurse practitioner with SHEM Ministries. And this is our spiritual, healthy, enlightening mandate ministry that God birthed right here with SHEM. All right. God bless each and every one of you. Have a good one. I pray that you have a restful night's sleep. Adios, amigos. I'm not Pastor Devlin, but we connected. All right.